We started the preparation with a groove at the gingival level. We use the diamond tip number 1014. The inclination of the drill should be 45 degrees and the depth of half a drill. This groove limits wear and forms the chamfered cervical end. The palatal groove was made with the 1014 diamond tip. The inclination was 45 degrees and the depth of half a drill. This wear preserves the dental cingulate and determines the shape of the cervical end. The anatomy of the vestibular face was defined with diamond drill number 3216. The drill's anatomy makes orientation grooves. The union of these grooves determines the anatomy of the prepared tooth. The 1.2 mm wear, the space for the metal ceramic crown. The grooves must be made following the two inclinations of the vestibular wall. The final anatomy of the dental preparation is made by correctly positioning the diamond drill. Mistakes happen when we change the orientation of the diamond drill. The 3216 diamond drill has a thickness of 1.2 mm. A uniform wear must be produced with several grooves of this depth. During the finishing phase, we will increase the wear depth to 1.5 mm. This thickness increases the space for the metal ceramic crown. A more suitable aesthetic can be made with more space for ceramics. The mistake in dental preparations because we do not check whether the wear was really made with the depth of the diamond drill. The inchisal anatomy must be planned accordingly. The transparency of the enamel in this region requires greater wear in this region during dental preparation. A more transparent inchisal requires a greater ceramic thickness. The angle between the inchisal and the proximal should be constructed without a metallic bottom. The enamel layer protects the matrix. The diamond drill wears out the metal matrix. The metal matrix does not protect the enamel of the antagonistic tooth. Without space, the diamond drill wear the neighbor tooth. The slice creates enough space for the 3216 diamond drill. This procedure prevents wear of the neighboring tooth. The diamond drill 3118 has a concave shape. This anatomy is ideal for wearing away the palatal surface of the previous teeth. However, it has no reference to determine the wear thickness. Measuring the thickness of the provisional dental, we can evaluate the amount of wear of the tooth. We must use a diamond drill with a larger diameter, 4138, to join the orientation grooves. With the 4138 diamond drill, we will make a more regular dental surface. The silhouette technique prepares half the tooth for didactic reasons. In clinical care it is not necessary to do. The canine cingulate is an important part of retaining the prosthesis. Excessive wear can be removed by decreasing the retentive capacity. The inclination of the inchisal surface must be preserved. This region is aesthetic and the deflection of light is important. Making a regular and uniform dental surface is extremely important. It favors the flow of materials. Procedures such as fabricating the provisional restoration, molding and cementing the prosthetic crown is easier when the dental surface is even. The margin is the most important region in tooth preparation. A well-defined and properly positioned margin guarantees the longevity of the crown.
Aneuto preparação is necessary. Detalhes market diferença.